I'm Alice. Welcome back to Men Health 30, where we don't shy away from the truths about men's health, especially sexual health. And if you're currently using Tadalafil, or considering it, then today's video might help you avoid some of the dangerous mistakes that many men make. Tadalafil, often mistakenly called the magic pill for sex, is actually a phosphodiesterase type 5 inhibitor. It works by increasing intracellular cGMP levels, which leads to smooth muscle relaxation, enhanced blood flow to the corpora cavernosa, and thereby significantly improves erectile function. You may have heard of Viagra. That's sildenafil, an older generation drug. But Tadalafil is different. Longer-lasting effects, faster onset, and more flexible use, which is why it's currently the choice of millions of men worldwide. So, what exactly can Tadalafil do, and are you using it the right way? Let's uncover all the facts, backed by scientific data, right now. Fast-acting and long-lasting. That's why Tadalafil has become the top choice to replace Viagra. After ingestion, the medication starts to take effect in just about 30 minutes, reaches peak concentration after 3 hours, and most notably, its effect can last up to 17 hours, a time frame that gives you flexibility without being tied to the clock or a schedule. In terms of dosage, Tadalafil is commonly available in two strengths: 5 milligrams for daily use and 20 milligrams for use as needed. But that's not all. Some manufacturers have developed sublingual tablets or dissolvable strips, which allow for faster absorption and are convenient in sensitive moments where taking a pill with water might feel awkward. There are even individuals who combine Tadalafil into subdermal testosterone implants, aiming for a two-in-one solution, improving both hormone levels and erectile function. What does this tell us? Tadalafil is not just a drug. It's becoming a versatile tool, increasingly personalized in ways few people realize. But there's one extremely important point, and many people misunderstand this. Tadalafil does not create desire on its own, nor does it cause an erection by itself. The medication only works when there is actual sexual stimulation, whether physical or psychological. No arousal, no stimulation, no effect. So, if you're expecting that just taking the pill will make you instantly ready, unfortunately, that's not going to happen. Understanding this mechanism is the first step to using Tadalafil effectively and without disappointment. Tadalafil isn't just for erectile dysfunction. It's a much more versatile treatment tool than you might think. One of the lesser-known indications is premature ejaculation.
Why?
Because there's a group of patients who experience secondary premature ejaculation due to erectile dysfunction. They fear losing their erection midway, which leads to an unconscious escape reflex of ejaculating early. In such cases, Tadalafil helps strengthen the erection, reduce psychological pressure, and is often combined with an SSRI like paroxetine to better control ejaculation timing. Another common indication is benign prostatic hyperplasia, BPH. For patients with symptoms like difficult urination, frequent urination, or weak urinary stream, a daily dose of 5 milligrams Tadalafil has been shown to improve urinary flow and quality of life, thanks to its mechanism of relaxing smooth muscle in the bladder, neck, and urethra. In summary, Tadalafil not only enhances your performance in the bedroom, it also contributes to better urological health and overall psychosexual well-being in men. There's a growing trend quietly spreading in gyms, and it's directly related to Tadalafil. More and more people are using this medication with the goal of boosting endurance, enhancing physical performance, and even increasing muscle pump during weight training. Sounds appealing, right? But slow down. I do not recommend this. Because behind the hype about performance enhancement lies a chain of consequences that most users never see coming. I'll make a dedicated video about this topic in the future, but for now, you need to understand this. Tadalafil is not a supplement, and using it for the wrong reasons could cost you your sexual health. What's the right dose? The truth is, there's no one-size-fits-all number. Tadalafil is not the kind of drug where one dose fits all. It's a journey of trial, adjustment, and optimization based on how your body responds. Backhand index pointing right for on-demand users, 20 milligrams before intercourse is the most common. Backhand index pointing right, some people combine a daily 5 milligrams dose with 20 milligrams when needed to maintain stability, but still have that extra boost when necessary. Backhand index pointing right, others do fine with 5 milligrams daily, 5 milligrams every other day, or even just 2.5 milligrams. Here's the bottom line. The optimal dose is the one that helps you achieve a good erection without causing side effects. And ideally, always start with the lowest effective dose, then adjust upward if needed, instead of going big from the start and taking unnecessary risks. Should you take tadalafil daily or only when needed? This is one of the most common questions. And the answer is, there's no one-size-fits-all formula. Every individual and every couple has their own rhythm of intimacy. Backhand index pointing right, if you're sexually active on a regular basis, a low daily dose, 5 milligrams, might help maintain stability and give you more control. Backhand index pointing right, if your frequency is low, or if you prefer clear timing, then on-demand use, 20 milligrams before intercourse, may be more appropriate. The key is to look at your real-life context. How often do you have sex? Is your sex life stable, or does it depend on schedule and mood? Do you prefer to be ready every day, or just need support for special occasions? Understanding your own routine, that's the key to choosing the right regimen. A very common question is, does tadalafil work for everyone? And the answer is no. Unfortunately, it doesn't. In fact, around 35% of patients do not respond to tadalafil, even when taking the correct dose, the correct way. That number increases to 44% in diabetic patients due to vascular and nerve damage that affects erectile function. And for those who have undergone prostate removal surgery due to cancer, the failure rate is even higher because the nerve system involved in erections is often severely impacted. So, if you've tried tadalafil but haven't seen results, you're not alone, and that doesn't mean you're out of options. What's important is to identify the true cause of the issue, and from there, choose the right course of treatment. That may involve a different therapy or a combination of supportive methods. Does tadalafil cause addiction? The answer is not biologically, but possibly psychologically. Mechanically, tadalafil does not create chemical dependency like addictive substances, meaning you won't go through withdrawal symptoms if you stop taking it. However, over time, some users begin to believe that only the medication allows them to perform well. And that belief leads to psychological dependence, a quiet, self-reinforcing loop. That's why anyone starting tadalafil should have a clear strategy, not just for effectiveness, but also for knowing when to taper down and how to transition away if necessary. So, what's the good news? Even if you want to stop taking the medication, there are plenty of alternatives such as sex therapy, vacuum erection devices, or natural support techniques that help restore erectile function without long-term drug use. Bottom line, you use the drug, but don't let the drug use you. Don't let the mild side effects fool you. Tadalafil, even though it's a prescription medication, can still cause a range of side effects that make many users hesitate. Backhand index pointing right nasal congestion, runny nose, backhand index pointing right headaches, backhand index pointing right back pain, widespread muscle aches, backhand index pointing right a general sense of fatigue or bodily discomfort. While these are often considered not serious, for some people, they're enough to disrupt daily life. However, the side effect you absolutely must pay attention to is a rare but serious one: an erection lasting more than 4 hours, medically known as priapism. If not treated promptly, this condition can cause permanent damage to erectile tissue, potentially leading to complete loss of erectile function. That's why tadalafil should not, and must not, be used by people without a clear medical indication. No erectile issues? Don't use the drug, because the risk of damage you're taking on might be far greater than the benefit you think you're getting. Here's a question many people are afraid to ask. Can tadalafil stop working? The answer is yes, and it happens more often than you might think. At first, the drug works well, but over time, you may notice that it's not as strong as before, the response weakens, or in some cases, nothing happens at all. This is a sign that your body is becoming desensitized to tadalafil, a phenomenon known as pharmacological tolerance. Why does this happen? There are several reasons. You've been using it too frequently or continuously, especially in cases of misuse like in gyms. Your underlying health conditions have worsened, such as diabetes, high blood pressure, or hormonal imbalances. Your dosage is no longer appropriate, either too low to be effective or too high, causing the opposite effect. And one often overlooked factor, psychological dependence, where you no longer believe your body can perform without the drug. The good news? If you catch this early, you can reverse it by adjusting the dose, changing how you use the medication, or adding supportive therapies. You can restore the drug's effectiveness without endlessly increasing the dose. If you've made it this far, then you've likely realized one important truth. A man's sexual performance isn't just about what happens down there. It reflects his overall health and how he chooses to manage it. But what if I told you that there's a 100% natural solution with no side effects, no dependency, and it's already helped thousands of men regain erections as strong as when they were in their 20s? Would you believe it? This isn't some empty promise. It's a simple method, backed by science, and currently gaining global attention. Backhand index pointing right, especially effective for those who haven't responded well to tadalafil, or who want to break free from relying on medication. Backhand index pointing right, it takes just 7 seconds a day, and the results have even surprised medical professionals. Pushpin, the full video explaining this method, is pinned in the comment section. Watch it now, before it gets taken down. Because sometimes, just one timely decision can change everything in your sex life. Tadalafil is an important topic, and it's becoming a regular part of many men's routines. If this video helped you understand yourself better, or helped you avoid a costly mistake, please share it, drop your questions in the comments, hit the like button if you found value, and don't forget to subscribe to Men Health 30 for more honest, real, and essential discussions about midlife men's health. I'm Alice, and I'll see you in the next video.